Greetings from SAANS Foundation. I'm Dr. Bose. I'll be speaking about a very interesting area, the counseling techniques at SAANS Foundation. Dear friends, you will agree that the counseling plays a very important role in the clinical practice. 60 to 70% of the patients which we handle in our clinical practice, they have a significant amount of mental component. Now, I'm not talking only for the doctors. I'm talking about anybody who is handling, situations, whether it is applicable to oneself or with the community at large, or with the family or the students, or wherever you're working. I think the counseling is very important for the right kind of guidance, because many times, we are guided by so much of wrong information that the body goes into a kind of a cascading system, and we get all kinds of symptoms of anxiety and apprehension. Now, what exactly is counseling? Counseling is a kind of a two-way connect, is a kind of interaction where the counselor and counseling develops a kind of rapport to resolve certain situations like the conflicts, the indecisiveness, the distress. And there are so many situations, in the society which needs this kind of interaction, because unless and until there's a two-way connect, we really cannot get into this kind of problem solving. And there are 5 things which are very important when we talk about the counseling techniques. The first thing is the reassurance. So whosoever is doing the counseling, whether it's a school teacher or a mother doing for the children, or the parents doing for the children, or for the community at large, or a counselor or a doctor, whosoever is, the first thing is that you have to be reassuring. Then the second is that empathy. Empathy plays unless and until you empathize with the person who are doing it, you will not able to develop the rapport. Then comes the kind of what you call the resolving the conflicts, or what you call the clarification. So once the clarification is resolved, then only you come into the confrontation, and finally we call the interpretation and problem solving. So whenever you go into a systematic way, what you call the laddering, you understand the concepts. So it's very important your algorithm, your approach should be very systematic. And that's why when you do a counseling, a systematic questionnaires are very important, because when we talk of mental health, there are so many things: your physical component, your mental health component, your emotional component, your environmental component, your career component, your financial component, your intellectual component, your social component, your what you call the cosmic component, your belief, and everything plays a role. So what we have done at SAANS Foundation, we have made the tailor-made questionnaires for all the components. Now I want to discuss about 5 situations which we handle very often in our clinical practice. The first thing is the post-traumatic stress disorder. Now, post-traumatic stress disorder is a very common problem, especially after the COVID time, and also you hear a lot of, it can happen to anybody. Suddenly you lose somebody, or maybe you are detected with some kind of diseases, or maybe there is a loss in the family. So there we have to train the mind based on adversity questions. That is called the resilience. How can you enhance the resilience? So there entirely the technique is different. So there probably we have to use a lot of techniques. We have to use philosophical techniques, we have to use psychological techniques, we have to use a lot of interdisciplinary techniques. So what suits the best? Probably we have to understand the person's psyche, the faith, and everything. So adversity question is entirely different. So the coping techniques, and this is very relevant in the post-COVID times, and this is a situation what is called PTSD. The second situation is depression, and depression is clinical depression is very relevant because of the society is witnessing a lot of issues, because now we have a longevity, people are jobless, they are not occupied, early retirements, post-retirement issues, then interpersonal relationships, and all those things. So the clinical depression is entirely you have to skill the person based on the emotional component of the brain. So an emotion of the brain is entirely handled by a different portion of the brain, that is the inferior portion of the brain, what you call hippocampal, the amygdaloid. So there we have to use a very distinct way of rationalizing the mind, what you call rational emotive behavioral therapy. We have to rationalize the brain. So there we have to understand. So unless and until you map the brain with different questionnaire and specific questions, you will not able to use the skill sets. The third area we handle very commonly in our clinical practice is the insomnia. People are not sleeping enough. They have short sleep, and that's why you have all the social anxiety disorders. People are eating more, weight gain, and all those things. So insomnia is an entirely different way of counseling. There we have to understand the biological clock, the melatonin release, what is a good time for sleep, whether you're early bird or a late sleeper. So based on that, we have to talk about the pre-sleep habits, we have to talk about visual imagery, melatonin release, use of melatonin and all those things. So entirely the sleep counseling is entirely different. And many times we have sleep disorders like sleep apnea and all those that has to be addressed. The fourth area which we handle in our clinical practice is substance abuse, which is quite rampant. And when we talk of substance, primarily we are talking about the tobacco and alcohol. And of course, the people go for the drugs. There we have to understand the why they are taking it, what kind of support they require it to make them feel happy. So there we have to talk about the dopaminic pathway. So here we talk about how we can, enhance natural dopamine pathway by substitution. Like for example, in tobacco we use nicotine replacement therapies, and in alcohol we use certain techniques, and anti-abuse techniques and all those things. So there we have to need different kind of tailor-made therapies when it talks about substance abuse. Then of course, then another area is work-life balance. And many times what happens, people are working throughout the day on the laptop, they are not doing any physical activity. So there the work-life balance involves a lot of autonomic nervous system. That means a balance between sympathetic and parasympathetic. There are breath meditations, mindfulness techniques, they are very useful. So they are really very useful, especially when you give them a specific breathing techniques. Then disease perception. Sometimes, what I'm suddenly you're detected with a cancer or some chronic debilitating disease, how you perceive the disease, you go into major depression. There you have to use a mixed tools, a combination. There probably the philosophical counseling is very useful, the midwifery counseling is very useful. So sometimes you have to use the interdisciplinary and also use the patient education tools. Then social anxiety disorders. People go get panicky because they are not able to plan things, they don't organize themselves well. So that's why they go into a lot of social anxiety, because they are not very organized from the mind. So they are probably there. The cognitive behavioral therapy plays a very important role. Then logical behavioral therapy. There's another tools which we use, which helps in social anxiety disorder. Then of course, another last but not the least, another clinical situation we handle in our clinical practice, what we call somatization. They always feel that they are not well, and they always get aches and pains. They get all those symptoms. They feel hypochondriac. So they're the patient education tools, very helpful. You educate the patient through visual methods, make them understand this is how it works, and give them a solution for it. So dear friends, these are the 8-9 clinical situations we handle in our clinical practice, and we are quite effective. So unless and until we have interdisciplinary approach, we use different counseling techniques as a multimodality and interdisciplinary, we really cannot give problem solving. So my appeal to all those who are watching this video, we are coming up with a short interactive course on multidisciplinary, interdisciplinary counseling course, which is very short term. We'll start with a one-day workshop followed by this course, and it will be there will be a lot of partnering bodies will be here. There will be major institutes like Delhi universities, other private universities, those who are involved. We will have a team of psychologists, philosophers, professionals, therapists, who all will be chipping their ideas, and basically it will be case centric, so that you understand how to go about it. So thank you, friends. Please go through our those advertisements, and we are coming up with shortly with those short-term course on interdisciplinary counseling therapy. Thank you. Regards, Dr. Rose.